and there are little hooks where you actually lift the skin and you put it on the hooks. There were some problems with that where the hooks were not quite sinking in, or you could see the threads underneath it. What was that?
Well, as with most of these procedures, it came out with a lot of hoopla and was supposed to be the next great thing. But when it began to develop a track record, there was problems with visible pulling on the face by those threads, and then the threads would give way, and the facelift, the sagging would recur. And so then the hoopla went away and people stopped using it as much.
Would it be possible that one side of the face the threads might give out on, and so that one side of the face might...
As a matter of fact, that is one of the problems, is that there was visible signs that was what was used.
So do you believe that people should go back to the traditional facelift? And the truth is that if you want something done, you have to have it done surgically correctly, and that would be the way.
Well, I always try to tell patients that if there's a way to lift the face better than the gold standard procedures that I use now, I'll adopt it. So once you see me doing it, you'll know it's a procedure that works. The one standard I have for adopting a new procedure is it has to work, and it has to be safe. And because these procedures don't have a long track record, and they are often taking shortcuts to give you less recovery time, they aren't as good as the traditional procedures at correcting the laxity. And secondly, they don't appear to last as long. So when it comes to your face, I don't think it's worth taking those chances.
Yeah, it's the only face you have.
Right.
If you'd like to call in with a question for Dr. Mobley, 361-4675. Don't be shy. Pick up the phone. He's here right now. And we have Betty on the line. Hi, Betty. Go ahead with your question.
Hello.
Hi.
I'm 25 and have deep lines in my forehead and between my eyebrows. I have a very stressful job. What can I do about that? Or should I do something about this at my age?
25 is certainly a common time that we see patients come in for Botox injections for that very problem. So it is a very non-invasive procedure. It just takes a few minutes to perform. And so it is really made to order for what you're concerned about. In fact, I think we have a couple of images of that we can show you. So it is something that can be taken care of rather easily and without surgery and non-invasively. So I think, yes, I think there is a good way to take care of that.
All right, thank you for your call. And we actually are going to show some of those pictures right now. We have a before and an after of Botox. Mm-hmm. And while we're bringing that picture up, the thing about Botox is it's not actually a filler. Doesn't it paralyze the muscle in the face?
Yes, it does. It's a diluted toxin, and as you can see from the photographs, the upper picture is before Botox was injected, and after about 4 days later, the second picture was taken. And you can see a dramatic difference in the lines in that area, and it may not look at it, but she is trying to flex those muscles. There are always concerns when you're using a product like this, but it's been around for about 25 to 30 years now with a very safe track record. So I think those concerns can be put to rest at this point.
All right, and now we have Tammy on the line. Hi, Tammy. Welcome to Local Doctors on Call. Go ahead with your question. We're ready.
Hi, Alex. Dr. Mobley, I was wondering if I would be a candidate for the CO2 fractional laser. I'm very dark complected, and just wondering if I would end up with discoloration with that procedure.
Yes, that's a very good question, because the darker your complexion, the less of a candidate you are for the fractional CO2 laser. And so we are much more conservative and careful with patients with dark complexions. And if it's extremely dark, you may not be a candidate. So that's, again, one of the reasons you want to come in and be evaluated by a plastic surgeon. Is part of my job is to tell patients when they aren't candidates for a procedure, as well as when they are. And so a darker complected patient is sometimes a candidate for fractional CO2, but it's very important that we see your skin and evaluate you first.
Thank you for your phone call, Tammy. And if you have a question that you'd like to ask Dr. Mobley, the phone line's open right now, 361-4675, 361-4675. And we will take more of your questions when we come back from the break. So please stay with us. Welcome back to Local Doctors on Call. I'm Alex Redman, and tonight Dr. David Mobley of Sarasota Plastic Surgery Center is here answering your questions about facial rejuvenation. And we were talking about mini lifts, facelifts, and we started to talk about the different things like Botox, which paralyzes the muscle and stops you from moving it so you can't form those lines. What would you use for somebody that needs more than that, but they didn't want plastic surgery? Maybe they have droopy skin and they have lines. Is there a way to work with that?
Yeah, certainly. There are many non-invasive procedures you can use before you get to the point of doing surgery, and we try to offer patients that whole spectrum. You can add volume to the face, which is an excellent way to make the face look more youthful, especially in the cheek area and the temporal area. And we do that with both fat, which we transfer from the hip area or abdomen, or you can use Sculptra, which is an injectable that's done in the office in just a few minutes. And Sculptra stimulates collagen and adds fullness to the face. In addition, you can use hyaluronic acid fillers, which are most people have heard of now, Restylane, Juvederm, Prevel Silk. There are many different brands, and they're great for these lines that travel from the nose to the mouth, and the lines that occur right at the corner of the mouth we call the marionette lines. And you can even use those for the lines that form in between the brow in addition to the Botox. So there are a number of methods. Even laser resurfacing, I think, would be considered fairly non-invasive. So it's not truly a surgery where you use a scalpel or any, and there's not a lot of incisions or anything like that. And so with laser resurfacing, you can tighten the skin and get rid of wrinkles. And so commonly I'll do fat grafting along with laser and maybe some fillers. And it's a totally non-invasive procedure.
All right. Now we have Nancy on the line. Hi, Nancy. Welcome to Local Doctors on Call. You may ask Dr. Mobley your question.
Okay. Hello, doctor.
Hello.
Hello. I do a lot of research on the computer, on the internet regarding, different procedures. And I was a little concerned about, I had read with the CO2 fractional laser, some people afterwards get hyperpigmentation or grid lines on their face. What's done to take care of that?
Those are, when they occur, hyperpigmentation is when too much pigment forms after the procedure, and grid lines are when the spots that are laid down by the laser are visible. And both of those are easily relieved by just application of a topical product called hydroquinone. And it's a bleaching agent that takes that away. Most of the time when patients get that, it's because they go out in the sun too soon and they get sun exposure before they should. But it is a possibility, and we always are ready to quickly act on that and start the hydroquinone when it occurs. So fortunately, it's easy to get rid of.
All right, thank you for your phone call. And if you would like to reach Dr. David Mobley, you may go online, sarasotaplasticsurgery.com. That's sarasotaplasticsurgery.com, or simply pick up the phone and you may call him at 366-8897. We'd like to thank you for being on the show. It was very interesting. We didn't even get through half of the questions that I wanted to ask, but you'll be back again in a few weeks, obviously.
Yes.
And we'd like to thank you for taking time out of your very busy day to watch Local Doctors on Call. Check us out on Facebook, press the like button, and we'll see you next time. Remember, it's your health.